I'm Kate.
I'm Ebong.
And I'm Sonia.
And today we're dishing with you from the brand new Cities, located at 919 19th Street, right here in the heart of Washington, downtown.
It's a lot of nines.
How often do they change over the cities?
You know, the theme of the theme of Cities is cities. So you can try food from Havana, like this arroz con pollo over here. You can try stuff from Beijing. You can try stuff from Washington, D.C., stuff from Athens. And they change the cities every few months.
So you have time to come and have what I like to call the Olympic cities, because Beijing, Greece,
but you have to come back pretty frequently because it's going to change. One's going to change every 2 months or so. So you'll be able to try something new all the time and get old favorites.
So they're all staggered. It's not just, you know, like a whole set of changing. Yeah, every couple of weeks or a couple of months you can come and have something different.
You can find me here every couple of months eating something new.
Every couple of days.
Yumminess of the world.
Well, our guest today is a very interesting man. He is Dr. Harshad Sanghvi, who has a great organization called JHPIEGO, which is, tell us about it. Don't let me explain it, you tell us.
JHPIEGO is an affiliate of Johns Hopkins University.
That's the JH in
that's right.
JHPIEGO.
And we were incorporated 35 years ago and currently work in almost 50 countries, but we've worked in almost 120 countries in developing countries around the world.
What does JHPIEGO do?
And our mission is really to help women and their families. It's a health mission, and we are working to save these lives of women and children in developing countries. We have programs that span across family planning, HIV/AIDS, maternal and newborn health, cervical cancer prevention. So a whole number of things that really ail women in developing nations.
So why women versus men or any other
families?
Any other families as a whole?
I think the problems for women are probably the worst in Africa and Asia, and so our organization was based with the mission to help women and their children, very specifically because we have expertise in that area, and we believe that many of the innovations and smart ideas can make a big difference in the lives of women, say in Kenya, which is where
actually I could see that, because especially in developing nations, you tend to find women having less rights than men, unfortunately. So as a result, they would require that help in order to continue to help
women are
grow.
Marginalized completely, and women are
like even less than property.
Absolutely, absolutely. So oftentimes they don't necessarily get the care from their families or from the system. The care for them generally is of not very good quality. So we are working with governments in countries, with partners in developing countries to really improve the status of women as well as their health.
How do you decide where to go? Where was the first place you went? And then how do you decide where to go and who you're going to help? Because I'm sure everyone wants you to come and help them, but how do you make that decision?
I think we first of all select the countries that are in the most need. So let me tell you one new country that we've been working in the last 3-4 years. That's Afghanistan. It is a country in which women have been marginalized over the last 20, 30, 40 years. The health statistics are awful. And many women die there of childbirth and childbirth related complications. So it is a major problem. So we went out there just when Afghanistan opened up to help rebuild midwifery and the health care of women, so that they could really survive childbirth.
So women have been suffering from simple things that we take for granted here in the U.S. From a health perspective or healthcare perspective. You're saying versus complications, but like minor complications that we take for granted
here in the States.
Here in the States, that
absolutely. For example, one of the leading causes of maternal death, that is death during childbirth, is hemorrhage. Now nobody dies of hemorrhage here in the United States, but lots and lots of women die. Every year more than 500,000 women will die from these kinds of complications.
Is it because the medical community is not well trained in those countries, or is it because of some sort of cultural, you don't want to go in if you think that this is the way that you're supposed to be giving birth, and it's a very private thing in different countries? What is
I think it's a mixture of all of those things. Number one, first of all, the health facilities are very few and very far from women. women cannot reach them. So, for example, in Afghanistan, there are very few facilities, so people have to walk for miles before they can get to a hospital.
For miles. It's not even like taking a cart. You have,
absolutely.
You're pregnant, you're
right.
having your child, and you're walking.
Well, I guess if you know you're pregnant, you try to stay near a hospital for a while because...
So it is a problem because I think they cannot get... So one of the strategies that we are really doing is rather than waiting for women to come to our hospitals, is to take some of that care right to where women are. And to be able to do that, we have to shift the way we practice our medicine, because there are certain types of things that we can do to help women at home.
So being a lot more mobile and do you use new technology in order to do that?
And what we are doing in our extreme affordability project is very specifically design those kinds of technologies that can in fact be taken to women right where they are. A few years ago, we actually developed a new test for detecting cervical cancer. And regularly women here will have a pap test,
right,
and they get that every year, and they're protected from cervical cancer. In developing countries, that's not possible because the test needs to go to a laboratory, and if it goes to the laboratory, it'll take many, many weeks before the results get back to the woman. So we developed a test with just ordinary kitchen vinegar. And this is a test that works very well, that midwives are trained to use, and they can detect conditions in women.
Can this be used here in the United States if we wanted to as well? Yes.
We can use it, but it's we have a better test,
right?
And an easier test because we have laboratories. Where you don't have laboratories and where you don't have those structures, then this is a good alternative, and it's very inexpensive. And midwives, nurses, right there out in the periphery can detect these conditions and treat them. Something that's not possible.
So you're not just going to provide healthcare services, you're also going to provide training, to give new ideas, to help people to figure out also maybe how to treat themselves a little bit too.
Right. We are a development agency, so our work is creating the capacity in those countries to be able to look after themselves. But our healthcare system and our kinds of models of healthcare just doesn't work in that kind of environment. So they've got to figure out, we've got to help them figure out what kind of system and what kind of technologies they need. So let me give you an example of another condition that kills many, many women during childbirth. One of them is postpartum hemorrhage. And the way we prevent postpartum hemorrhage here is that women get birth in a hospital. They're assisted by a professional provider who gives them certain injections to make the uterus contract, and they don't bleed. That is not possible in developing countries. In many women in development, almost 50% of births occur without a professional midwife or provider in those countries. So they just don't have the possibility of doing this. So what we did is we took a medication that's an oral pill that we provide to women during the antenatal period. And they keep these medications with them, and when they have the birth, they swallow these tablets, and it protects them from hemorrhage. So right there at the time of birth, they pop these 3 pills, misoprostol the drug is called, and they have a lot less hemorrhage. Now, we give this to the woman herself, because the one person who is absolutely likely to be present at birth is going to be the woman herself. So she keeps the medication, and that helps her protect herself, even if there isn't a skilled provider, even if there's even if she cannot get to hospital. And that is huge, because it really empowers her, gives her the satisfaction that even though she cannot get to hospital, she will have something to help her.
Well, that's one huge thing you're doing, but it sounds like you're doing many huge things, and it sounds like you're making a name not only for JHPIEGO abroad, but also here in our local area. So thank you so much for all that you're doing, and thanks for coming on and telling us about this fascinating development project.
Thank you very much.
As always, we appreciate having the doctor on, and we also appreciate having you with us. Please continue to follow us on Facebook and follow us on Twitter, and as always, come back and watch us right here on the District Dish.